Almost all of these children are going to die, and very few of them are going to reach adulthood.
Ой, у нас просто тупик, больше уже некуда обращаться.
It's their last hope.
Это единственное место, где могут нам чем-то помочь.
And they think it's the only place they can be helped.
We sat and talked, particularly in the beginning when we first came, and they said they just dreamed about blue kids. Every place you go, you see so many blue kids.
These are all my little kids, all my little children. We get very emotionally attached to the patients that we deal with, and when we lose one, we lose a little piece of us.
One of the cardiologists on our last visit, the first 7 children he saw were inoperable. And, you know, it's devastating.
Матерей. Мы очень рады и довольны.
This program, Heart to Heart, made everything for Andre. He lives now, and we are pleased, and she is pleased very much.
It's working. I mean, it's really working. When we walk in the door, and they just go to work. I mean, it's just this common bond of what they want to do, their common purpose.
We're not taking away scarce resources from the United States. We are literally teaching them the ability to repair hearts that are born deformed, such a level of care that virtually every child in America has available to them. The results overall have been quite good. Somewhere between 85 and 90% of the patients that have been operated on are alive and doing well.
I'm happy. I'm scared.
I almost feel guilty. She is one of the few lucky ones who got help.
At last, the day has come when we can have hope that our son can live like other children.
I think one of our nurses said it the best: whatever you give to this program, you can get back many times.
Good to see you again. You take care, okay? Bye.
Спасибо вам. Thank you.
Oh, thank you.
From time to time, when we revisit 60-Minute stories, we find dramatic changes, and this is certainly one of them. When we first reported this story 10 years ago, the Russian medical system had all but collapsed. We went to St. Petersburg with a team of American doctors who were determined to do something about it. They came from Children's Hospital in Oakland, California. Calling themselves Heart to Heart, they were spending their vacation time giving little Russian children with heart problems a chance to grow up and lead normal lives. Russian doctors didn't have the skills to perform even simple heart surgeries considered routine in the United States. We first met the American Heart to Heart team in 1992 in St. Petersburg at the cardiac unit at Children's Hospital No. 1. Here's how we reported it then. These children are dying. They're so weak, they squat instead of stand, and even have to walk that way. Some can't walk at all. Their parents carry them everywhere. They were born with congenital heart defects, and if they'd been operated on as infants, as they are in America, they'd be leading normal lives. But these are Russian children, and the surgery they need is almost impossible for them to get.
I would say that overall, the majority of them will die because there's very few cardiac centers.
Dr. Christian Hardy is the chief cardiologist for the Heart to Heart team. He told us that when he first came here to this hospital in St. Petersburg, it was like stepping back in time. Russian medicine was about 40 years behind ours.
We saw patients laid out on beds with IVs that weren't sterilely inserted. We saw lack of supplies, reused supplies over and over and over, and we saw children who, with very simple problems, were inoperable and dying. I had a little boy run down the hallway, got halfway down the hallway, he started teetering a little bit, and then he squatted down. And I went to find him fanning himself very blue. And I was actually quite worried at the time. I was afraid he was going to get into deep trouble right there in front of me, and picked him up.
The Rechet's family had been told repeatedly by Soviet doctors that 2.5-year-old Andrei wouldn't make it to his 3rd birthday.
So it's very common for this to happen with this heart lesion.
They read about the heart-to-heart program and took a 20-hour bus ride to get here.
We have the blood available in.
Dr. Hardy told the family Andrei could finally get the surgery he needed.
We're planning on doing him first thing in the morning.
But cardiac surgery is high risk, especially here where the surgeons don't have the diagnostic equipment they need to know ahead of time exactly what they'll find. Andrei's heart was far more damaged than the medical team had suspected. He survived the surgery, but after he was transferred to the intensive care unit, his heart started to fail. The Americans and Russians teamed up to do immediate emergency surgery on Andrei right there in the intensive care unit.
In my opinion, the worst is over.
But the worst wasn't over. Andrei's kidneys began to fail, and the hospital didn't have the diuretics that could have saved his life. The next day, Andrei Rechet's died.
I take this all very personally. These are all my little kids, all my little children. And when we lose one, we lose a little piece of us.
Our medicine is fantastically poor.
Dr. Mark Silberman, the Russian head of cardiology at the Children's Hospital, works closely with the American team.
Was there no sophisticated medicine being practiced anywhere in the Soviet Union at all?
It was for communists, for high-level military men.
But just for the top party brass?
Yes.
For the creme of the Communist Party?
Yes. Sour cream, yes.
Sour cream.
The Americans have donated millions of dollars worth of high-tech equipment to the pediatric intensive care unit. Dr. Hardy took us to see what most Russian intensive care units look like.
And this is what the whole place looked like.
This is what all the intensive care units look like. There are 2 babies in here now, and as you can see, there's no monitors on the wall.
The Russians reuse syringes, even the disposable plastic ones brought over by the Americans. There's also a shortage of nurses, so family members stay with their children and cook for them, and even clean the floors. More serious is a shortage of blood. When we were there, a patient needed an emergency transfusion. A Russian doctor rolled up her sleeve and donated blood on the spot. But there was no way to help this little girl. She needed an antibiotic, but there was none available in the entire city of St. Petersburg. The heart-to-heart team can only operate on a dozen or so children during each 2-week visit. The doctors tell us the hardest part of their job is choosing which kids get a chance to live and which don't.
You know that it wouldn't be the same in the United States. You know it would never happen that way. It's hard. You want to put all of them in your suitcases and bring them home. Yet that's not a reality either. That's not what's going to help the system over here.
That was 10 years ago. Were they successful? Did they help the system? Well, we went back with Dr. Hardy to find out. And at least in that cardiac unit, we found the answer is yes.
Oh my.
We found the ICU a totally different place.
Look, it's not even close to the same room. Now, when I was here, I don't even think you were seeing kids that young.
No, we were doing older children.
Yeah, and look, they're all infants.
Before Heart-to-Heart came here more than a decade ago, babies with congenital heart defects were simply sent home to die.
I remember a little girl who died in this bed.
Today, the Russian doctors here do 300 surgeries a year with a success rate equal to that of hospitals in the United States.
We needed to teach them the basic building blocks so that they could gradually become self-sufficient and do things on their own. And that's really what they've been able to achieve.
Dr. Vadim Lubomudrov was their star pupil. He was chief surgeon and head of the children's cardiac unit back then. He has the same title today.
There were no monitors. If there was a monitor, it wasn't working, was what I remember.
I try not to remember because it's, for me, it's like a nightmare. All these years we've been improving everything, and now we live in these conditions, and I cannot imagine how it happened at that time.
This is the famous cabinet that was empty last time.
We still need to save many things, but we don't have such terrible shortages anymore.
You can't say that about the Russian health system as a whole. In most places, illness and mortality rates are rising. Doctors have to scrounge for essential medicines. Even other parts of this hospital are struggling. But Dr. Lubomodrov's unit is still supported by donations mainly from the U.S. One benefactor from Virginia raised over $2 million to pay for renovations and essential supplies. A grant from the Conrad Hilton Foundation and Toshiba paid for this new $2 million cardiac catheterization lab for diagnosing complex cases and determining if a child's defect is operable or not.
It's very eerie to be right here.
Right here was in the recovery room where little Andre's bed was 10 years ago.
When we were here, little Andre Reches died. It was devastating. If he were here today, would he die?
Probably not. That's one of the difficult things, you know, as we've seen the program grow, you think about how, well, gee, if we had just done him today, maybe he would be alive. But you can't turn the clock back. You have to go with what you have. And at the time, that's all we could offer, and it wasn't enough at the time. But today, we have the satisfaction of knowing we save children like him.
What about the other children from our first visit? Remember this little boy? He was operated on, and today at 18, he's a healthy university student.
Molchanov?
10 years ago, Dr. Hardy also saw 8-year-old Sasha Molchanov.
He's working real hard.
Sasha was operated on and discharged from the hospital. Without surgery, his life expectancy was only another 3 or 4 years. Today, 18-year-old Sasha knows he's one of the lucky ones.
I feel like a normal, healthy kid. There are practically no restrictions. We consider it like a second birthday, a miracle. Thanks to the help of the American surgeons, we are grateful because they returned our son to life.
Sasha's perfectly healthy now and can barely remember the days when his heart was so weak his lips turned blue and he had trouble walking even the few blocks to school. And he's only one of the miracles. Since 1992, the heart-to-heart team, Americans and Russians, has operated on about 2,900 children.
The American doctors, the heart-to-heart doctors, hoped that what would happen was that they would train doctors like you, and then you would train other Russian doctors. Is that what's happening?
Yes, it's happening all the time. I spend part of my time teaching, almost all my time teaching. And we did the same trips as Americans did for us.
While the Russian health system continues its decline, this program stands out. Dr. Hardy's dream has come true.
This trip has been particularly wonderful for me to see other children and see how it's been able to come to fruition.
Hi, how are you? Well, come on, give me a hug, need hugs. How are you?
During our visit, several of the children whose lives were saved came back to thank Dr. Hardy.
Sir? Walking into the unit, seeing the smiling faces, the children who benefited from the program, that was certainly our dream. I don't think I really believed in my mind that it would ever get to where it is now.